Assalamu alaikum. Now let's discuss about adolescent idiopathic scoliosis. What is adolescent idiopathic scoliosis? It's a lateral curvature of the spine in upright position in the coronal plane. It's a lateral curvature of spine in upright position in coronal plane. If lateral curvature is less than 10 degree, if lateral curvature is less than 10 degree is spinal asymmetry, and more than 10 is scoliosis. So lateral curvature less than 10 degrees spinal asymmetry, and if the lateral curvature is more than 10 it is scoliosis. What are the risk factors? It may be female sex, age less than 12, or you can remember less than 10. So age less than 10 degree, age less than 10, curvature more than 10, early pubertal status, premarital status, skeletal immaturity, and severe curvature curve angle more than 25 degree. Management of scoliosis is based on the risk of curve progression. The greatest increase in curvature occurs during early adolescence at the time of pubertal growth spurt, after which progression slows and subsequently stops once the bone ossification is complete. The first step, if you find a case with adolescent idiopathic scoliosis AIS, first step is X-ray of the spine. If it is mild 10 to 30 degree, monitor every 6 months. If it is moderate 30 to 40, thoracolumbar spine brace. If the degree is 30 to 40, thoracolumbar spine brace. If it is severe, surgical fixation. More than 40 to 50, surgical fixation should be done. This is the scoliometer by which we can find out the scoliosis. So less than 10 degree spinal asymmetry, more than 10 degrees scoliosis. This is the Cobb angle. It is measured how most displaced upper vertebra and most displaced lower vertebra. It forms an angle. It forms an angle. Okay. More than 10 degree is diagnostic. This Cobb angle more than 10 degrees diagnostic. Further evaluation is required if the following red flag pathology are present, like back pain, neurologic symptoms, rapidly progressing curvature more than 10 degrees each year, and vertebral anomaly. If there is vertebral anomaly on X-ray, do MRI of the spine. Okay. Now look at this question. This 13-year-old girl for pre-participation of sports physical, she's planning to lacrosse, which she had played the previous school year. The coach notified the mother that the girl's posture seemed abnormal. Physical examination, right-sided lumbar prominence during forward bend test. During forward bend test, there is right-sided lumbar prominence. There is no tenderness of the spine, no neurologic problem. What is the next step? The next step, if you find a case with scoliosis, adolescent idiopathic, adolescent girl, scoliosis, go for X-ray of the spine. This is the X-ray lateral S-shaped curvature on the thoracic And the lumbar spine, lateral S-shaped curvature on the thoracic and lumbar spine. So first step is X-ray. X-ray of the spine. Look, dextroscoliosis, S-shaped dextroscoliosis. This is dextroscoliosis. This is levoscoliosis. This is the Cobb angle we have already discussed. And if mild, Cobb angle 10 to 30 degree can be monitored clinically every 6 months. A thoracolumbar spine brace, this is for more than 30 to 40 degree. If it is more than 40 to 50 degree, then surgical fixation. If 40 to 50 degrees, surgical fixation should be done. Okay, look at this question. This 12-year old girl comes to clinic for evaluation of poor posture. Her coach noticed that her shoulders seem to uneven when he stands. Examination. Her mother had scoliosis during adolescent but did not require treatment. Her mother had scoliosis, did not require treatment. Examination show right-sided rib rise with mild scapular prominence on forward bending. Plain radiograph of the spine reveals right thoracic scoliosis with a Cobb angle is consistent with mild scoliosis. Which of the following is the current findings is the greatest risk factor? This is a premenstrual girl, so premenstrual status is one of the risk factor. Other like female sex, age less than 12, skeletal immaturity and severe curvature. So mild scoliosis, her premenstrual status indicates that still has significant remaining growth potential. So she should be clinically monitored for curve progression until 2 years after menarche. When skeletal maturity is typically complete. Okay, so that is all about AIS, adolescent idiopathic scoliosis. Hope you enjoyed.